Problems with voice quality, volume, and pitch are common, but they don't have to be permanent. In Focus on Your Health, Teresa Snow explains.
Focus on Your Health is sponsored by MU Healthcare.
Kalen Stieferman never really appreciated his voice until it changed drastically, affecting everything from his business to his relationships.
So the problem's upstairs.
Kalen Stieferman is rarely quiet. For the owner of a wood flooring company, talking to customers and contractors is all part of the job.
It's really educating customers as to what's going to happen. I'll take a sander and sand that initial edge.
But business became more difficult about 2.5 years ago.
As soon as I would talk, people would back up, and I'd have to say, I'm not sick, because that's what it sounded like.
Thyroid surgery had damaged a nerve. It's a known complication that left him sounding like this.
My name is Kalen Stieferman.
And what brings you
I'm here because my voice doesn't work.
At University of Missouri Healthcare, Dr. Mark Gilbert recognized the problem. One of Kalen's vocal folds was not moving.
One vocal fold has to come next to the other, and they have to touch, and they just barely touch and vibrate against each other, and that generates sound.
As the only fellowship-trained laryngologist in mid-Missouri, Dr. Gilbert was able to carve a small implant that pushes the vocal fold over. Kalen was awake during surgery and talking to help Dr. Gilbert make the right adjustments.
We got to one location, and all of a sudden there was this booming bass voice that he hadn't heard in 2 years.
Rainbow is a division of white light into many beautiful colors.
Kalen soon returned to selling floors, but he says the surgery meant much more than that,
I told him, I said, you saved my life.
allowing him to communicate and connect.
Cool, we're set.
Joining me now is Dr. Mark Gilbert, a laryngologist here at MU Healthcare. You carved that implant specifically for Kalen. Why?
So there are commercially available implants, but there's only a few sizes, and every person is a little bit different. And so carving it for each person can give you a much more accurate result and restore that person to their actual voice.
Looking at all of your patients, is surgery common or just one option?
Surgery is actually the rarest option for any sort of voice problem. The most common therapies are some sort of voice therapy or even physical therapy occasionally, depending upon the patient.
You started the Voice Center here at MU Healthcare. You're one of only 3 fellowship-trained laryngologists in the state. We're glad you're here. How did you get into this specialty?
So actually, I was a classically trained singer, and I've been singing for years, and when I was doing my training, I found out that one could be a doctor for the vocal athlete, which really appealed to me.
And there's a lot of people who use their voice for a living.
That's right. Singers, teachers, even the person who makes your coffee. Any person who needs their voice for what they do is a professional voice user, and a voice problem can really affect their livelihood.
Okay, thank you very much, Dr. Mark Gilbert. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.